Tonight, blue or brick red gums make this an ER decision, not a morning call. Lift the lip, check the color, then know when to stop checking and leave. A dog can be quiet on the couch and still be in real trouble. That is why gum color is useful, and why it can scare you when you finally look. Pale, blue, brick red, or yellow gums are not cosmetic details. They can point to shock, poor oxygen, overheating, anemia, or jaundice before your dog can show you where it hurts. Before you decide this can wait until morning, you need to know what gum color is actually measuring. I'm Dr. Maya Hart, a small animal veterinarian, and I want you to have the same quick screen we use in exam rooms. When a sick dog comes through the door, I am not only watching the tail, the eyes, or listening to how the owner describes the night. I lift the lip early because the gums can give fast clues about circulation, oxygen delivery, red blood cells, heat stress, and liver or bile trouble. This does not replace a veterinarian. It does not diagnose the exact disease at home. But it can tell you when the situation has moved from watch closely to get help now. Let's make this simple. You will learn how to check safely, what normal pink looks like, what pale or white can mean, what blue or gray means, what brick red means, what yellow means, and the point where you stop checking and head for the ER vet. The color matters because your dog's gums are one of the few places where you can see circulation directly. Your dog's gums are mucous membranes. That means they are thin, moist tissue with tiny blood vessels sitting close to the surface. When blood is moving well, carrying oxygen well, and the body is not in a crisis, the unpigmented areas usually look bubblegum pink to salmon pink. Not neon red, not gray, not white. Pink. Some dogs have black or brown pigment on their gums. That pigment is normal for many breeds and mixed breed dogs. A black patch is not the same thing as a blue gum, and a brown spot is not the same thing as jaundice. That detail matters. If your dog has one, you are looking for a natural, unpigmented patch. The easiest place is often above the upper canine tooth, the big fang tooth near the front of the mouth. If that area is darkly pigmented, try the gum above the premolars, a little farther back. But do not put your fingers far into the mouth. You are not checking tonsils. You are checking the visible gum line. Here's your first useful test. Lift the lip. Find a pink area. Press that gum gently with your fingertip for about 1 second. It should turn pale under your finger. That is called blanching. Then let go and count how fast the pink color returns. In a healthy, comfortable dog, pink usually returns in about 1 to 2 seconds. That is called capillary refill time. It is a small window into circulation. If it takes longer than 2 seconds, or the color looks muddy, gray, or odd, the body may not be moving blood through the small vessels the way it should. Feel the moisture too. Normal gums should feel slick and moist, like the inside of your own cheek. Tacky, sticky, or dry gums can go with dehydration, fever, poor perfusion, or a dog who has been panting hard. Moisture alone does not tell the whole story, but dry gums plus weakness, vomiting, diarrhea, collapse, or strange stillness should raise your concern. Think of the gums like a small dashboard light on your car. The light does not tell you which part has failed, but it tells you the system needs attention. Pink, moist gums with quick refill are reassuring. Pale, blue, brick red, yellow, dry, or slow refill gums are not random colors. Once you understand what pink and fast refill mean, the dangerous colors stop looking random. Before you try this, check safety first. Do not do a gum check on a dog who is growling, snapping, guarding the mouth, or painful around the face. A frightened dog can bite without meaning to hurt you. If your dog is too painful or too distressed to handle, that is information by itself. Call the ER vet and tell them what you are seeing. For a calm dog, use good light. A kitchen light, bathroom light, or phone flashlight aimed from the side can help. Do not shine a bright light straight into your dog's eyes. Sit beside your dog, not face to face like a challenge. Speak softly. Touch the shoulder first, then lift the upper lip with one hand. Look above the canine tooth. If that area is pigmented, slide your view along the gum line toward the premolars. You are looking at the color of the tissue, not the teeth. Tartar on the tooth can be yellow or brown. That is different from yellow gum tissue. Food stain on the lips can mislead you. The gum itself is the screen. Compare both sides if your dog allows it. One side may be easier to see. Press a pink patch for 1 second, release, and count. 1, 2. The color should come back by then. If you are counting 3, 4, 5, or you are not sure the pink came back at all, do not brush it off if your dog also seems weak, cold, restless, bloated, or not like themselves. Normal variation exists. A dog who just played hard may have redder gums for a short time, especially while panting. A dog who chewed a toy may have temporary gum redness along the chew side. A dog with black spotted gums may never give you one perfect pink window. That is why knowing your own dog's normal matters. But normal variation should match the story. A happy dog after a backyard fetch session with moist pink gums and quick refill is different from a dog lying flat after a hot walk with brick red gums and heavy panting. A dog with a few black pigment patches is different from a dog whose unpigmented gum tissue has turned gray-blue. Pair the color with behavior. Gum color becomes more urgent when it comes with collapse, weakness, heavy panting, vomiting, a swollen belly, bleeding, coughing, fast breathing, confusion, cold paws, or a dog who will not rise for a favorite treat. A normal gum check does not rule out illness. Dogs can have pain, infection, stomach trouble, or early disease with normal-looking gums. But an abnormal gum check raises the urgency. That is the whole purpose of this home screen. It does not ask you to name the disease at midnight. It helps you decide if midnight is too long to wait. Here's the line I don't want you to cross. Some gum colors are not watch and wait colors. Pale or white gums are one of those colors. Pale gums can mean shock, internal bleeding, severe anemia, heart trouble, or poor circulation. Sometimes the gums look like pale pink paper. Sometimes they look almost white. If your dog is weak, collapsed, bloated, bleeding, breathing fast, or strangely still, pale gums should make you move. Owners often want to warm the dog, offer food, search online, or wait to see if the color improves. I understand that instinct. You want to help without overreacting. But if the body is not circulating blood well, waiting can steal the narrow window where treatment works best. Blue, gray, or purple gums are even more urgent. Those colors can mean poor oxygen delivery. You may see open mouth breathing, choking signs, coughing, stretched neck breathing, or panic in the eyes. You may also see a dog who is too tired to fight anymore. Blue or gray gums are not a home care project. They are an ER signal. Brick red gums are a different warning. They can show severe heat stress, overheating, sepsis-like inflammation, or irritation from certain exposures. In a hot dog who is panting hard, vomiting, having diarrhea, stumbling, or acting confused, brick red gums should make you think about heat stroke until a veterinarian proves otherwise. A rectal temperature around 104 degrees or higher, if you can check it safely, adds to the danger. Yellow gums point in another direction. Yellow gum tissue, especially with yellowing in the whites of the eyes, can mean jaundice. Jaundice can come from liver disease, bile duct trouble, or red blood cell destruction. You may also see dark orange urine, vomiting, not eating, or sudden tiredness. Yellow is usually not the same type of run out the door in 60 seconds color as blue gums with breathing distress, but it is not a wait all week issue. One common mistake is checking only the tongue. The tongue can fool you. Some dogs have dark tongue pigment. Panting can change how the tongue looks. Lighting can make it look redder or darker than it is. The gums, especially an unpigmented patch with a refill test, are the better home screen. Before you try to treat a color, remember this. Color is a clue, not the disease. Pale gums are not fixed by sugar water. Blue gums are not fixed by opening a window. Brick red gums are not fixed by letting the dog sleep it off. Yellow gums are not fixed by a bland meal. Once those danger colors are clear, the real payoff is knowing exactly what each color tells you to do tonight. Keep this decision filter in your head. If the gums are normal pink, moist, and the refill time is about 1 to 2 seconds, and your dog is acting normal, you are in the more reassuring zone. If there are mild symptoms, like a soft stool, a skipped meal, or a little tiredness after a busy day, you can call your regular vet for guidance if those signs persist. Keep watching. Offer water. Keep the routine quiet. But do not use normal gums as permission to ignore a dog who is getting worse. If the gums are pale or white, look at the dog, not just the mouth. Pale gums plus weakness, collapse, a swollen belly, bleeding, cold paws, fast heart rate, fast breathing, or unusual stillness means ER now, not after a nap. Not after one more internet search. A dog with pale gums and a bloated belly is especially concerning because deep chest or large breed dogs can develop life-threatening stomach twisting. If you see unproductive retching, drooling, restlessness, and a tight belly with pale gums, leave. If the gums are blue, gray, or purple, the decision is also ER now. This is especially urgent if your dog is open mouth breathing, stretching the neck to breathe, coughing, choking, wheezing, collapsing, or looking panicked. Keep the airway as clear as you can. Do not put your fingers down the throat unless you can see and safely remove a visible object. A blind finger sweep can push an object farther back or get you bitten. If the gums are brick red and your dog has been in heat, on a summer walk, in a warm car, in a hot yard, or in a stuffy room, treat that as heat danger. Heavy panting, vomiting, diarrhea, wobbliness, confusion, weakness, or collapse makes this urgent. If you can safely take a rectal temperature and it is around 104 or higher, that supports the concern. But do not delay leaving just to find a thermometer. For heat stress, move the dog to shade or air conditioning. Use cool water, not ice water, on the paws, belly, groin area, and wet fur while you arrange ER care. Air movement helps. A fan, car air conditioning, or open airflow across damp fur can help remove heat. The goal is controlled cooling while you are getting veterinary help, not a long home experiment. If the gums are yellow, check the whites of the eyes in good light. Look at the urine if you have noticed it becoming dark orange or brown. Think about appetite, vomiting, belly discomfort, weakness, and sudden tiredness. Yellow gums with a sick dog means urgent vet or ER care. If it is Saturday night and your dog is not eating, vomiting, and yellow, do not wait until Monday. If the gums look muddy, brownish, gray-pink, or you cannot decide what color you are seeing, use the whole dog. A bright dog with normal breathing and quick refill gives you time to call for advice. A weak dog with strange breathing, cold feet, a slow refill, or a blank stare needs help. Uncertainty plus a sick-looking dog should push you toward the ER, not toward sleep. This is the point where checking stops. When you see blue, gray, or purple gums, you stop checking. When you see pale or white gums with weakness, collapse, bleeding, bloating, cold paws, or strange stillness, you stop checking. When you see brick red gums with heat exposure and distress, you cool while leaving. When you see yellow gums with vomiting, not eating, dark urine, or sudden lethargy, you call urgently or go in. The safest pet parent is not the one who owns every gadget in the bathroom cabinet. It is the one who knows the line between home observation and medical care. That gives you the emergency map, but the safest pet parent also knows what not to do while driving. Do not force food into a dog with abnormal gums. A sick dog may vomit, aspirate, or need anesthesia, and a full stomach can complicate care. Do not give human pain medicine. Ibuprofen, naproxen, acetaminophen, and many combination cold medicines can harm dogs. Do not pour water into the mouth of a weak or collapsed dog. If they cannot swallow normally, liquid can go into the airway. Do not spend 20 minutes trying 5 internet remedies for shock, breathing trouble, or collapse. Shock is not a pantry problem. Poor oxygen is not a supplement problem. Severe heat stress is not a see how they look later problem. Your job is to reduce harm, keep the dog as calm as possible, and get to the people with oxygen, IV fluids, imaging, blood work, and emergency drugs. For breathing trouble, keep the dog upright in the position they choose. Many dogs with breathing distress do not want to lie flat. Keep the car cool. Call the ER on the way if another person is with you, and say the words clearly. My dog's gums are blue, or my dog's gums are pale and he collapsed, or my dog's gums are brick red after heat exposure. That helps the team prepare. For pale gums with suspected bleeding, keep your dog quiet and limit movement. If there is visible bleeding from a wound, apply gentle pressure with a clean towel while heading in. If the bleeding seems internal, such as pale gums after trauma, a swollen belly, or sudden collapse, there may be nothing helpful to press at home. That is when speed matters. For yellow gums, do not give leftover antibiotics, human liver supplements, or old medications from another pet. Jaundice needs a cause. In my clinic, yellow gums often lead us to blood tests, liver values, red blood cell counts, urine checks, imaging, and medication decisions based on what is actually wrong. Guessing at home can waste time. Once the emergency colors are handled, build the habit before you need it. Pick one calm moment each week. Maybe after a quiet walk. Maybe while your dog is relaxed beside the couch. Lift the lip, look at the same gum area, press for 1 second, and count the refill. Notice the shade of pink. Notice any black pigment pattern. Notice moisture. If your dog allows handling, take one clear phone photo of normal gums in good light. Do not use flash so close that the color washes out. That photo gives you a baseline. Later, if you are standing in the kitchen at night, wondering if the gums look too pale, you have something real to compare against. Keep a simple mental note. My dog's normal gums are salmon pink. My dog has black pigment on the left upper gum. My dog's refill is usually 1 second. My dog's gums are moist when healthy. That baseline can keep you from panicking over normal pigment and can also help you spot a change sooner. Check after unusual tiredness. Check after heat exposure. Check after vomiting or diarrhea. Check after an injury. Check if you notice pale stool, dark urine, sudden weakness, coughing, fast breathing, or a behavior change that makes the room feel wrong. Pet parents often know when their dog is off. Gum color gives that instinct a body sign to pair with. Senior dogs deserve a lower threshold. So do dogs with known heart disease, immune-mediated anemia history, liver disease, heat sensitivity, bleeding disorders, cancer, or dogs taking medications that can affect the stomach, liver, blood cells, or clotting. If your dog has one of those histories, ask your regular vet what gum changes should trigger an ER visit for your specific dog. Flat-faced breeds also need caution. Bulldogs, pugs, Boston Terriers, and similar dogs can get into breathing trouble faster, especially in heat or stress. If a flat-faced dog has blue-gray gums, loud breathing, weakness, or panic, do not wait for the color to improve at home. Their airway can make the margins smaller. Large, deep-chested dogs need extra caution with pale gums and a swollen belly. Great Danes, German Shepherd dogs, Standard Poodles, Dobermans, Weimaraners, and many mixes can be at higher risk for bloat and twisting. The gum check is not the only clue. Restlessness, drooling, a tight abdomen, repeated retching with little or nothing coming up, and sudden weakness are enough to act. Small dogs are not exempt. A small dog with pale gums after trauma, vomiting, bloody diarrhea, or collapse can be in shock too. A tiny dog can also become dehydrated faster after repeated vomiting or diarrhea. Size changes the handling, not the seriousness of abnormal gum color. Use gum color as a triage tool, not a diagnosis. Triage means sorting urgency. It tells you which door to choose: home observation with a call to your regular vet, urgent appointment, or ER now. It does not tell you the complete reason. That is why 2 dogs with pale gums may need different treatments. One may be bleeding, one may have anemia, one may have heart disease. The color tells you not to ignore the situation. This is home care safe only if your dog is comfortable being handled, breathing normally, standing or resting normally, and the gums are pink, moist, and quick to refill. If the color, breathing, or behavior crosses the emergency line, home care has done its job by warning you. Now, the hard boundaries. Do not wait overnight for blue, gray, white, or brick red gums when your dog is distressed. Distress means trouble breathing, collapse, weakness, confusion, heavy panting that does not settle, repeated vomiting, a swollen belly, active bleeding, cold limbs, or a dog who seems far away from you. Sleep is not treatment. Do not force food. Do not give human pain medicine. Do not pour water into the mouth. Do not induce vomiting unless a veterinarian or poison control professional tells you to for that exact exposure. Do not try essential oils, alcohol rubs, random supplements, or old prescriptions for shock or breathing trouble. For heat stress, move to shade or air conditioning. Use cool water, not ice-cold water, on the paws, belly, and groin area. Keep air moving. Then go to the ER. Ice-cold water can make surface blood vessels clamp down, which can work against steady cooling. Cool water and veterinary care are the safer path. This video is dog-focused, but cat owners need the safety line too. Gum color rules are similar in cats, but handling stress can make a sick cat worse, and cats hide illness even more. Blue, white, gray, or yellow cat gums need urgent veterinary care. Do not wrestle a struggling cat for a long mouth exam. Put them in the carrier and call. The quiet dog on the couch is no longer a guessing game. You have a check that takes seconds, and you have a line where love means leaving the house. Tonight, before you let a dog who seems off sleep it away, lift the lip if it is safe. Look for normal pink. Press gently and watch the color return in 1 to 2 seconds. Feel for moisture. Then match what you see to the whole dog in front of you. Pink, moist gums with quick refill and normal behavior are reassuring. Pale or white gums with weakness, collapse, bloating, bleeding, cold paws, or strange stillness mean ER now. Blue, gray, or purple gums mean ER now. Brick red gums with heat exposure and distress mean cool while leaving for the ER. Yellow gums with yellow eyes, dark urine, vomiting, not eating, or sudden lethargy mean urgent veterinary help. You are not being dramatic when you check. You are being a protector. You are using one visible body sign to keep fear from making the decision for you. Tell me your dog's name, age, breed, and what their healthy gum color looks like when they are calm. If your dog has black pigment patches, mention that too, because another pet parent may be relieved to know that pigment can be normal. Share this with someone who might mistake a quiet dog for a safe dog tonight. Give your dog a gentle scratch from Dr. Maya tonight, and check that one safety line before you try anything new.